We'll see you later. All right, now we turn to the city of New York, HomeBase, with Melissa Mowry and Linda Gibbs.
Hi, good afternoon. I'm Linda Gibbs. I'm the Deputy Mayor for Health and Human Services in the City of New York. And I'm joined by Melissa Mowry, who's the director of our Bed-Stuy HomeBase program. It's a pleasure to be here today. We're here to talk to you about our community-based homeless prevention program. This is a data-driven approach to preventing homelessness. It was designed in 2004 to do three things. First, to use data to overcome the skepticism that potentially homeless families cannot be distinguished from their neighbors. Second, to provide flexible resources to stabilize and resolve a housing crisis. And third, to use the government procurement process to hold providers accountable, not just for the clients they serve, but for the entire community. This is a dramatic evolution from the existing preventive practices in New York and around the country. Nationally, homelessness prevention efforts reflect tremendous goodwill, increased resource investments, and the recognition that institutionalization of homelessness in shelter offers a Band-Aid, not a solution. At the same time, and as the literature reflects, preventive efforts are all too often fail to reach those in need. A history of challenges with targeting scarce public resources abound and discourage further efforts. In 2004, Mayor Bloomberg confronted the assumption that homelessness is simply a fixture of urban life and introduced a 5-year plan to reduce homelessness by 2/3 across the city. HomeBase is a key component of that plan. We started by targeting 6 high-need communities, which together account for 25% of all the families entering our shelter system. The model itself, a mix of case management and flexible resources for the clients, emphasized that flexibility to respond to the real needs of the household. And it gets us to the right households. Rather than providing another walk-in opportunity for those who self-identify, HomeBase finds those most likely to enter the shelter system and conducts outreach to those hard-to-serve and often service-resistant clients. To do this, we draw upon technology in new ways. We use data collection to provide each HomeBase program with their own community-specific at-risk profile, and we create geo-coded maps of recent shelter entrants, allowing HomeBase to identify community hotspots and to saturate those blocks with outreach resources. To serve clients, HomeBase has adopted a flexible service model that supports creativity at the local level. Each of the 6 providers designed a program specific to their community. The undocumented Latino immigrant population in Bushwick, Brooklyn, responds to a different type of outreach and service effort than the longstanding African-American community in Jamaica, Queens. We don't force them all into a one-size-fits-all solution. Melissa Mowry put this theory into practice at the ground level in Bed-Stuy, Brooklyn. Melissa?
So how do we prevent homelessness? First, let me tell you about Bedford-Stuyvesant. It's a Brooklyn community of 150,000. 32% of Bed-Stuy families live in poverty, and 500 families become homeless each year. The key elements that allow us to make a community impact are data sharing, individualized case management, and flexible funding. Based on the data I receive monthly from DHS, I know the typical Bed-Stuy shelter entrant is a 28-year-old female with 1 to 2 children. She's most likely being forced out of a family or friend's apartment due to overcrowding, discord, or violence. She does not have a high school diploma, and she is not seeking services. The only way we can find her is through targeted data sharing. The data shows us specific blocks in Bed-Stuy that she is most likely to be currently living. The geocoded maps are posted on the walls of our office, and we use them daily to coordinate our outreach. That is how we found Miss J, by conducting street outreach at a subway stop. Miss J was living with her son in her friend's apartment, and their relationship was tenuous. She felt her only option was to give up her job, disrupt her son's education, and spend the next 9 months in shelter. To stabilize her current housing, we negotiated with her roommate to allow Miss J to stay until we moved her into an affordable apartment and upgraded her job skills. We found safe, affordable housing and incentivized her to complete medical assistant training by paying a portion of her rent until she obtained a better job. She currently makes $300 weekly and supports herself and her son, and she is not alone in her success. 95% of HomeBase clients have remained out of shelter since the program's inception. Finally, we could not do this without the unparalleled level of partnership and communication between DHS and the HomeBase providers. This two-way flow of information fosters continual program improvements, promotes cooperation, and has created an exceptional venture in our goal of preventing homelessness.
I'd like to share with you some of the results. For the first 3 months of this year, home-based communities saw a 7% decline in shelter entry, while a control group of similar communities in the city had an 8% increase, and the citywide increase was 19%. Not only is HomeBase helping to keep families stabilized, but it's proving to be cost-effective. There is a projected annualized cost savings in New York City this year, were it to be operating at, citywide of $11 million. Thank you. Be glad to take your questions.
Thank you very much. Yes, David.
I think what you're doing is incredibly important, and I hope it works. But the data you just cited is for 3 months. And the first year data before that is 12% reduction compared to 10% in your control group. So it's not a huge difference. So my question is it too early to know how well this works and whether it's cost effective compared to alternative strategies?
I think over the course of the first year, each progressive quarter, we had improvements. And so in fact, the first couple of quarters, there was no difference. The programs were getting started. There was no model for this. It didn't exist within communities in New York City. And while we learned a great deal from some site visits we did in other jurisdictions with preventive programs, this was really unique in the way it's structured. And so we saw that progressive improvement, and then the first quarter of this year, I think, is really remarkable for the results. So not only is it preventing homelessness, but it's also saving money. I think it's also something that at this point in time is an important innovation to be sharing nationally. There's a few things going on where it makes it something of time being of the essence. There are across the country programs that are being adopted by states and localities. Over 150 governors and mayors have adopted citywide, statewide strategies for tackling homelessness. Those programs are fairly thin on preventive strategies because there just aren't models to look at. And this is something that I think will help others to understand how prevention can be strengthened and deepened in their own strategies. At the same time, the federal government is requiring all jurisdictions that receive federal homelessness funding to invest in management information systems, and it would be an important piece of information for those jurisdictions as they build their systems, that they shape the data collection mechanism in a way that helps them to think about how can you know about the condition of homelessness, not just to think about how you're going to shelter and then rehouse somebody, but use that knowledge to actually prevent.
Yes, Lee.
I want to pursue that point. You say there's now a mandate to collect this kind of data. The data that you've been using in order to target your prevention services, has New York been unique in having that data? And do you expect other jurisdictions to have it in as usable a form as you seem to have it?
So we are unique in that we have about a 20-year history of data collection. What we're not unique in is that we have not been good at putting that information into the hands of the frontline folks that have got to do the work and make a difference in the lives of families and children and adult, the lives of those that we serve. And so this is really something where we're modeling within this program ways that we can take that administrative data that the downtown office people use and really bring it out to the community and put it into the hands of the people who can make a difference. The other thing is that this is about to be nationally the investment in HMIS systems, homeless management information systems, and each of the jurisdictions that are receiving federal funds are going to have to be building systems. So using this to really inform what are the data elements that they collect so that they can have it, not just for thinking about how quickly can we move people through shelter, but how can we know how to better prevent.
Yeah, Ellen.
So, Melissa, you must have known that doubling up was a precursor to homelessness before this. You knew it generally, right? So can you say a little more specifically how the information you now get from DHS helps you in a way that the general knowledge about doubling up didn't?
Well, the information that we get from DHS on a daily and weekly basis is where these families are doubled up and in what location within my community district where these people are living. So that allows us to go out and fly our neighborhoods, try to have conversations with people, go to these specific blocks that are showing a high shelter entrance. So yeah, we know double up is a factor, but actually getting to the doubled up, The primary tenant shows up quite frequently, but the person who's doubled up, they don't necessarily seek services.
Just like an example of that, in Jamaica, Queens, it's a huge geographic area, several 100,000 people. When you look at the geocoded map, there's a cross boulevard and you can see it's just saturated with those little red dots. So that's information so that we're using scarce public resources more effectively.
Kathleen?
So that was really my question, just to understand it. What you do is you figure out geographically what communities are going to produce your greatest homeless population, and you target those communities with flyers, not individually, to say, we can give you some help. Is that really, that's the idea?
That's the idea. I mean, the idea is to try to have as many conversations as we can with people.
Got it.
But yeah, we go flyer the neighborhood.
Let me just come back and finish this on David's
Great.
question. Thank you. On David Osborne's question, because we were all, as a committee, we were struggling, where are the results? And you cited the first quarter. Should our decision look upon the first quarter as the central measurement of results? And so we, in effect, would be judging based on one quarter? I'm trying to struggle with what we're looking at here.
The program is about 1.5 years old, and each successive quarter, there's been improvements in the outcomes. And so what I would look at is that trajectory.
All right, let me ask you this question. Your application, which was filed in December, had a page or more of citations of various newspaper articles, New York Times, Daily News, and the like, when you launched in September of '04. Can you point us to articles in the Times and elsewhere on progress since?
The mayor's citywide strategy covers a massive homeless system. We have now 31,000 people in shelter. That's down from 36,000 when the mayor announced his plan 1.5 years ago. What I can point you to is a very comprehensive strategy, and we're managing all of these simultaneously, where we're launching pieces and we're deepening and tweaking pieces, and you'll see over the course of this 1.5 years, highlights of different aspects of that progress. Another is our
in the newspapers, in the New York Times.
Absolutely. The annual street count was announced 2 months ago, where it showed a 15% decline on the number of people who are living on the streets. Part of that is targeting the chronically homeless because we have better use of data. And that would be another point about this, that it's not just replicable in community-based prevention, but we're using the same kind of data-driven approach, putting information in the hands of the front line in other cohorts of our population. We're doing it with our criminal justice population. 30% of the discharges, 30% of our intake into single adult shelter are discharges from our city's jails. So we're using the same kind of approach to put the information into the hands of the discharge planners in the jail system so that they can understand which among the 100,000 individuals being discharged are most